My name is Nathan Edmondson. I work with Wells Fargo Insurance Services, and we'll be talking a little bit today about the WBBA Health Trust, which is a benefit to members, and something that I think maybe 3 years ago I would have looked at the audience, maybe seen a lot of heads dipping down, looking at their phones, but has really become front and center in most of our lives as health insurance has changed, how we purchase it, how we access it, how our employers purchase it. And so I'd like to go over a little bit of the value proposition of the Health Trust, sprinkle in some information about what's going on kind of out there in the marketplace, and we'll go ahead and get started. So one of the things that we really pride ourselves on with the WBBA Health Trust is that it's a fully integrated platform. Okay? It's not just a place where you buy health insurance, not just a place where you enroll employees or make changes based on life events, marriages, adoptions, things like that. It's a platform that really touches every aspect of an employee benefit package and how you manage that. It starts with product. Okay? You have to have the product to administrate it, obviously. We offer a very robust suite of products. We also offer consolidated administrative services, so you're not having to contract with multiple insurance carriers. You've got one place to do business, saves you time, saves you money, and also lets you focus on what you do best, and that's creating cutting-edge technologies and new business products. And also, more important, I think, today, maybe than even a couple of years ago, is compliance support. And many employers don't understand their liabilities as it pertains to privacy, as we heard from Chair Vault with HIPAA, as it pertains to some of the new requirements that the Affordable Care Act has placed on employers in reporting various things tied to premium, Affordable Care Act taxes, things of that nature, which you may not be aware of. You may not be aware of those liabilities, and that's where we come in and can help you understand those, give you the tools and resources really to manage those, and really, again, focus on your business. So the value proposition really is threefold. Number one is product, okay, product access. Many companies in the life science industry need a health insurance program the day that they get funding, and they may not have payroll records to show an insurance carrier that they are an established company. That is a requirement for small employers typically. You must show at least a quarterly or sometimes an annual 5208 Part A and B, which is a wage statement, payroll statement with the state of Washington. And that's not something that the WBBA Trust requires. Okay, that's something we've negotiated because of the needs specific to the life science industry. In addition to that, there's very limited restrictions on product access. You can get a full-blown medical, dental, vision, life insurance product suite available to you with this use to employees. So that's something that's available to you immediately on a corporation. Comprehensive coverage. So we understand that many employers need to compete for talent. You, as a small employer, may not be able to access the quality products and services you need to recruit an individual from a larger organization, to convince somebody to move across the country to help you develop your product. These are products designed specifically for that, to recruit and retain talent. Something to keep in mind there. We have held on to, I think, what many would consider legacy benefits. Okay? We have things like dispenses written prescription drug programs, meaning you are not forced to take a drug, generic version or a version of the drug that is cheaper for the insurance company. You get what your doctor prescribes. That's something that we've fought hard over the years to retain, and something I think that's very valuable to this industry. In addition to that, we contract with national carriers. So Premera Blue Cross, Delta Dental, Vision Service Plan. These are companies that have robust local, national, even international provider networks. So we try to recruit that salesperson from the East Coast. You have people that may be traveling internationally, looking for investors or looking for new partnerships. These are plans that can travel with them. Something that's very valuable, I think, to an employee and to an employer, to have that peace of mind when people leave the state or the country. They are covered, and that's something that they don't have to worry about during their travels. And then cost savings. Okay, that's also obviously a very big part of this. You want something that's going to be cost effective, cost predictable, and those are things that we take very seriously and something we fight very hard to maintain, is that you're aware of what your costs are going to be, and we keep those as low as possible, but without reducing the quality of the product. I think that's very important to understand. That is a common trait, I would say, in my business, the health insurance business, is reducing benefits to keep costs low. That's not our game here. We want to make sure that you have choice, you get quality, and that if you need cost-saving options that are available, we're not going to force you into a lesser product just to save some money. So that's something else that's a very key attribute to this program. As I mentioned, this is available to companies of 2 or more employees. Okay, this is one of the few what we call association health brand products, which are available through trade organizations like the WBBA that still allow companies as low as 2 employees to access these programs. Typically, you have to have 5 or 10 employees to access products like this. We have maintained that at 2 employees, and again, fought very hard to do that over the years. Our product suite is very robust. We offer 15 different medical products, deductible options of 0 all the way to 5,000. So that's a big benefit continuum where you may be in a stage where you need to recruit talent. You need that really rich benefit. Okay, we've got that available. You may be a company that's already established. You're not looking to hire 20 people. You're looking to maintain costs, but still a level of benefits that your employees expect. That's something we can do as well. And in many cases, you just need something to offer. Okay? It doesn't have to be comprehensive, but it has to be cost efficient. And I think we've done a really good job the last few years of building out the back end of our benefit continuum so that as you change in your business life cycle, you've got options. You don't have to leave the trust to go find another plan as you mature as an organization. So that's something I think is a very key attribute to the program. We've offered a wellness program for 6 years. We were one of the first association plans to do that. We have seen that really take, I'll say, some of the rate hikes that we've seen in some other marketplaces, and it's maintained a very healthy pool within our WBBA trust. That's something that's very important to identify there. Also saves employers money. So our wellness program gives you as an employer up to a 4% premium discount if you participate and meet those requirements of participation. So something that is, I think, a good benefit for employees, helps them be healthier, helps them be present in their job, but also saves you money as an employer. It's a nice incentive for you to introduce these wellness activities to your employees. We have dental plan options, which include orthodontia, vision plans that include a very special safety glasses rider. So if you have employees that are working in maybe a laboratory environment, they need some safety eyewear. That's something you can provide as the employer through this vision plan. So again, something very tailored to the life science industry. Life insurance, okay, something that we also offer, comes embedded with your medical plan, but you also have buy-up options. So if you need to have something that covers some of your high earners, multiple salary options, we've got that as well. We've got voluntary life products, so if you're able to provide maybe a little bit of coverage for employees but they need more, there's an option for them to buy it. And with this program, they have a $180,000 guaranteed issue life insurance policy. That's very difficult to get on your own as an individual or as an employer looking for a voluntary product. So that's something we definitely take advantage of if you're participating. And then we also offer custom disability solutions, both long and short-term disability. So really a full-blown benefit program that covers everything from medical to disability. And again, here's a list of our carrier partners, probably some familiar names to you right there. Premera Blue Cross up in Montlake Terrace, Delta Dental of Washington, which is the largest dental provider in the state of Washington. Wellspring Family Services, which is our employee assistance program provider, business service plan, and then Benefit Solutions, or BSI, who is our administrative kind of back-end support. Additional highlights. This are the things that when we promote the plan, we want you to experience. And that is, number one, things get done on time the right way. If your organization doesn't have a full-blown HR department, you don't want to spend time reconciling bills. You don't want to follow up on enrollment forms you sent off and the employee didn't get their identification card, they can't use their insurance. That takes time away from your day-to-day business. And that's something that we take seriously and something that we want to take that burden off you as an employer. We have an online enrollment platform, so if you want to get rid of this paperless environment, we're working very hard to get there. I would say that the insurance industry as a whole is a slow adopter of technology, but it's something that is becoming a requirement. It's a cost saver, right? Printing booklets, faxing enrollment forms, making sure they're received, resending them. But that costs time and money. So we are really dedicated to technology, making sure that you have that available to you on a 24/7 basis. You may not be able to sit at your desk from 9 to 5 and work on insurance enrollments. You may have to do that off the normal business cycle, and that's why we have that 24/7 access through our electronic invoicing and premium back end, and also the enrollment platform that's web-based. Compliance support. This is probably the thing I highlight most now because there are more requirements of you as an employer now than there have been in the past. And that's where we can step in and take some of that burden off you, whether it's COBRA administration. Okay, that's something that hopefully you're familiar with. We have a group administration guide which tells you all you need to know to navigate through the benefit program. In addition, it gives you information on things you may not know you're subject to. FMLA. Am I an FMLA employer? If I am, what does that mean? So we give you some tools and resources to understand that. We also love acronyms in the insurance world. COBRA, FMLA, TEPRA, OBRA, all these great acronyms that you've probably never heard of. But we've got a glossary of terms that you can look up to make sure that you're aware of what these things are and you're in compliance and that you remove that liability from your business practice. And again, we have the human component as well. We have people that are doing this day in and day out, available to you either through email, in person, or telephonically, so that you don't just have to read a guide, you can contact a human being and get support as well. And then lastly, investment technology. As I mentioned, we are very much looking to go an e-environment, paperless environment, and that will include an employee level portal where your employees can actually go in and make enrollment changes on their own without having to give you a piece of paper, send you an email to add their spouse, change their address, whatever that life event is. They can go directly on to our platform and make that change. Not available today, but it will be available by end of year, early 2015. So something that I think is going to be a nice value add to the trust. And then very quickly, I know I'm probably running out of time here, but I wanted to just give a sprinkling of information about what's kind of going on out there in the marketplace, some things that you maybe need to be aware of. There was a minor piece of legislation in 2010 called the Affordable Care Act, and I'm sure everyone's read the entire thing. I think it's about 35,000 pages. If you haven't, then I can certainly give you a briefing on anything that you'd like to know about it. But there's things that are happening right now. Health insurance exchanges. Those are popping up both for individuals and for employers. A little slower on the employer side here in Washington State, but certainly the individual exchange is up and running, has done very well comparative to kind of the national level and some of the things you might be hearing nationally about websites not working, people waiting 2 hours on the phone to enroll. That's really not the experience that's happening here locally. So kind of separating some of that national rhetoric from what's happening here in our local marketplace. Standardization of product offerings, that's something that's very significant, I think, to small employers because there are probably fewer plan options available to you as a small employer if you're going out to the direct market and you may be pigeonholed into buying a product that you may not want. And that's where the WBBA Trust and others like it may be an option for you to take a look and see if you can keep your plan and keep your employees happy. And then, really big deal here, elimination of health screening. In most products now, you cannot be rated for health. You can't leverage your health in getting preferred rates. So that is something that's happened that's really changed the way we buy insurance, the way that insurance is rated, and many of you may take advantage of that. Others you may be subject to the negative side of that too. New taxes and fees. I know everyone loves this. We love paying new taxes and fees, but regardless of whether we like it or not, these are happening. And these are things that you need to be aware of, what you're paying, how do you contract out with your employees or do you, and these are things just to be thinking about. Association health plans like the WBBA, approximately 60% of the association marketplace is out of business this year. This is a big deal. These are associations that have upwards of 250,000 Washingtonians enrolled in them. And like I said, over half of those, 60%, are being phased out. Okay? The WBBA is a survivor, will continue to be here, and it's something that you can take, I guess, a source of pride in and also rely on it that it's not going anywhere. Cost containment strategy shift. So this is something that is very important. Okay, sorry, I'll wrap up. But there's a lot of rhetoric in the marketplace about doctors fleeing networks changing, restricting access, things of that nature. And so just very important to note that your provider network may be changing. Be aware, and I'll transition my last slide now. Be prepared, be proactive, and let us know at Wells Fargo we can help you. I'm happy to address any of these questions up here. Any questions you have about the health insurance industry, about the WBBA Trust, we're here to help with this group. So thank you for the time, and I'll be back. Board of Users, I'd love to talk. Thanks.